Gaza, recently returned from the second. And because of the time differences between us, we had to pre-record that segment. Do be advised, please, dear listeners and viewers, that some of the images she has provided may be disturbing to sensitive viewers. They concern children. Our focus today is on children, particularly Palestinian children. And I'm going to be talking to, as I said, Dr. Mimi, the ER surgeon. The first video that you will see play, it's a very short video, less than a minute, will be of an influencer on TikTok, a young child influencer, 17 years old, called Mido Halimi. He documented the atrocities of the genocide in Gaza and the daily realities of living with the destruction in Gaza. And so the Israeli occupation forces targeted him deliberately with 2 sniped bullet shots to the head. They claimed that he was injured by shrapnel, but the CT scans that Dr. Mimi has provided show clearly that these were 2 targeted shots to his head. And of course, he's not the only one, but we're using him as an example of how Israel and the Israeli occupation targets children, especially those brave enough to share with the rest of the world what the genocide in Gaza feels like. Do watch Mido's video at the beginning of the segment. It really will give you an insight into living in a tent, swimming in the sea, etc. Alhamdulillah. And then we'll cross to Dr. Mimi's interview. As I said, some of the images there may be disturbing to sensitive viewers because they contain injured children, including a short video clip of Mido himself coming in injured. So please do take note of that. After that, we'll be talking to Nati Ngubani, the author of From the River to the Sea, in view of the fact that we are focusing on children today, but also in view of the fact that the bookshop in Jerusalem, the educational bookshop, was raided for the second time yesterday. And at 9 o'clock, we'll cross to Dr. Naledi Pandor, former Minister of International Relations and now CEO at the Nelson Mandela Foundation. So we've got a full and interesting lineup for you. Do stay tuned and interact with us. Over to you now for the video clip of Mido Halimi as an influencer. Please watch.
Welcome guys to a new vlog of my tent life. I started the day as usual with a hot cup of tea and then headed to the city of Khan Yunis. I wanted to see the destruction in there. It's really indescribable, the amount of destruction in there. Wherever you look, you're gonna see rubble. It's just rubble everywhere. It really depressed me what I saw. I went back to the tent and had liver for lunch and went for a swim. You guys won't believe it, I just found a phone in the sea, and when I came back to show it to you, it was lost again. So I went in again and I found it. It's right here. Then built a sandcastle, more like sand done with a rock. I know I can't build good sandcastles, but I'm not the worst. This is mine, and this is my brother's. I then made some hummus for dinner, and I'm gonna start editing the video now. Hope you guys see it tonight. Don't forget to follow me if you wanna see more content like this.
Myself, Aisha Kaji, your guest host at the moment. I'm very pleased to welcome to our show Dr. Mimi Syed, who is joining us from the United States. She's a board-certified emergency medicine physician, an assistant clinical professor at the University of Washington and Washington State University. She's a fellow of the American College of Emergency Physicians, and Dr. Syed served in Gaza from August 8th to September 5th, 2024, and again from December 3rd to December 31st, 2024, at both Al-Aqsa Hospital and Nasser Hospital. Dr. Mimi, thank you for joining us. Thank you for making the time. We really appreciate having you here to share your experiences with us.
Thank you for having me, Aisha.
Now, some of you in the audience may recognize Dr. Mimi from her Instagram posts where she goes as Dr. Mimi ER, and may have seen the heart-rending pictures she shared of young children with amputated limbs, with injuries where they had been targeted directly in the head and the heart. And I'll leave it at that. And over to you, Dr. Mimi. Tell us a little bit about your experiences just over 2 months ago in Gaza.
Yeah, actually, it was terrible. I mean, as a lot of people can see on my Instagram posts, I talk about Gaza a lot. I talk about the types of injuries I saw, the type of patients that I saw. And, I think it's common knowledge now, most of the patients that we saw were women and children. The
Mhm.
UN quoted more than 70% women and children. When I was there, I saw almost exclusively women and children. And those devastating injuries, gunshots to the head, to the chest, shrapnel injury, explosive injuries, significant complicated injuries that, no one should have to see in pediatric patients. But we saw that time and time again in August, as well as in December. But we saw more of kind of the cold temperatures in December. When I was there, we had up to 8 newborns die in the tents overnight because of how cold it was. And then, of course, we've seen recently it just continues to happen. Another 8, died again. So
Just last week, we've seen the numbers rise to eight children again. That's right, dying of cold, and that's in addition to the ones dying of malnutrition and starvation as well, and of course of the injuries that they've sustained. Now, Dr. Mimi, one particular case became very close to your heart. You documented the case of Meadow. I'm not sure, or Mido. I'm not sure how to pronounce his name. A young man who eventually, very sadly, passed away. Tell us about your experience with him.
yeah, actually, I didn't know who Mito was. When I was there in August, there were mass casualties coming in every single day, multiple times a day. And each of these casualty incidents had about dozens and dozens of patients. So one day on August 26th, multiple people were brought from this area in Mawasi Khan Yunis. It's an internet cafe that people used to go, either students or influencers like Mito. And in that area, there was an air raid. There was an airstrike, along with obviously earlier mass casualty incidents. But we had dozens of patients brought in with various injuries. I mean, there were shrapnel injuries, a lot of children that came in from the Mawasi area. But we also had a mix of patients come in with gunshots to the head. And when people brought them in, we would ask them frequently what happened. And they would say it was a quadcopter shot, shot these people. And Mito was one of them. And I have a video just, kind of explaining. I did that frequently when I saw patients, is explain what happened, where they were, how they were injured. And this particular video, I was saying it's a late teen brought in from Mawasi Khan Yunis, shot by a quadcopter. And when I examined him, he didn't have any other injuries except 2 wounds in the head. And I did a thorough ultrasound on his abdomen and his pelvis, which didn't show injuries, but also I was able to stabilize him, intubate him, and take him to the CT scan where his whole, we scanned his whole body and we didn't find any injuries except for his head, his brain. It's very suspicious for a bullet path. And I have those images too, and I showed a lot of those, all the images to colleagues of mine, many colleagues of mine who are trauma surgeons, who have experience with gunshot wounds to the head. And they said that it's, almost, it's almost certainly a gunshot wound to the head. Shrapnel injuries, which is what it was reported as in the news, typically pieces of metal in the body or in the head, but not a straight path that way. And ironically enough, at the time I didn't know who he was. So I came back to the US. My husband told me, hey, he used to follow Mito and very closely. He said, did you know that Mito passed away when you were there? And I said, oh, I don't know who that is. So I was going through my pictures one day just to process them. And I noticed this person looks very familiar. And I realized who it was. And I, Googled what happened. And I said, wait a minute, no, this is not shrapnel injury. I saw this patient. I touched this patient. I examined him. This is not a shrapnel injury. So I immediately was, obviously I was very upset about it being reported as shrapnel injury because it was just not true. I believe that Mito was targeted and deliberately killed.
Mm-hmm. He was deliberately targeted and shot in the head.
That's what I believe, yeah.
Yeah. And Mito was quite a big influencer on TikTok as well. Is that right?
Yeah, I mean, I learned about him and I kind of went through his account, and he had gotten a haircut on August 25th. And in the video that I have of him when he arrived at Nasser Hospital, you can see that fresh haircut. And it's just very eerie and very sad. But you can see what he was doing the day before. He went to an internet cafe, he got a haircut, and kind of went through his day. But yeah, it was it's devastating, and to this day, I think of him every day, and it pains me every single day that I wake up.
Yeah, one of your colleagues talking to the British Parliament and another one talking to American Congress, both fellow doctors who worked in Gaza as well, time and again have emphasized that children have been deliberately shot either in the head, or the one doctor said if he put his stethoscope over the heart, he couldn't more accurately pinpoint how that child was shot, because it was literally a direct shot to the heart. So there seems to be an increasing, in fact, a mountainous body of evidence that the Israeli army is actually targeting children with shots to the brain, with shots to the heart. You've seen that yourself, yet we very rarely see it reported as such in the press. And Israel seems to get away with this with impunity. Why do you think, as an American citizen, why do you think that is?
It's mind blowing to me how much that they can get away with, and it's complicity in various forms. But the media in the West is complicit. I think they have a lot to do with this impunity, and I've said this before on my interviews. It has to stop. When things are reported out of Gaza, you see them reported one way. From, for example, Al Jazeera. But when you see Western media, it is completely, a skewed view, and the viewers in the U.S. and in the West, they're not even getting a glimpse of what's actually happening. And I would do this often when I was in Gaza. I would actually keep up as best as I could with what was being reported and what I was seeing. And I would try to compare it and see, which media outlet is actually reporting what's happening. And I never saw what I was witnessing in Gaza at the time that I was actually there to witness it firsthand. I never saw it being reported in the Western media. And I was baffled. Like, how could this not make the news?
Yes.
And so, and this has been going on for 17 months. It continues. So, a lot of that is due to the media and the influence the media has over viewers and the citizens of these countries in the West.
Mm-hmm, mm-hmm. Well, I've been in the same situation myself in places like Sudan and in Iran, where what I'd be watching in my hotel room on BBC, and then I take a walk, an hour later, and the demonstration they were showing on the screen is the demonstration I ran right into, and it's a totally different scenario. So I understand exactly what you're saying, but on that particular issue of the media, as a healthcare worker, do you believe that the media should be held accountable for its role in the current genocide in Gaza, in the same way that, for example, radio television Mille Collines in Rwanda was held accountable for its role in the Rwandan genocide in 1994? And here there is much more overwhelming evidence, isn't there?
I mean, and that's the thing, right? Journalism is a profession, and truthfulness, honesty is extremely important. Having objective, presentation of what's actually happening should be the very underlying premise of journalism. And unfortunately, they've gotten away with completely being, away from that and trampling it underfoot. And I think that. Absolutely. I think that they have to be held accountable, just like the impunity that the Israeli government has. They have to be held accountable for these atrocities, because they not only is it being brought to their attention, but they continue to ignore it. And so, it's one thing if you're making a mistake and you didn't know, but like everyone has been saying this and screaming this at the top of their lungs, everyone who witnesses this. So it's time to change your ways. And yeah, if you're not complying with what everyone is telling you is the truth, then it's what else can you do? You have to be held accountable at some point.
At some point, I agree with you, and I think one thing a lot of people don't actually realize is that the legacy media, the mainstream media, if you will, particularly the big names around the globe, have largely been bought in by those with ties to the military industrial complex that benefits of these conflicts. So, for example, Jeff Bezos's ownership of the Washington Post and his recent directive to regarding editorial policy and the lack of independence thereof nowadays is very concerning. But I really believe that some of the bigger outlets, particularly who have continuously peddled stories about, baby beheadings and mass rapes of Israelis, etc., when indeed the opposite has been happening, and there is documented evidence of that to the Palestinians, they really need to be held to some degree of justice, because they have been complicit in this. Moving on then, Dr. Mimi, another thing that very often is said when hospitals and places near hospitals are targeted, and you've been at both Al-Aqsa and Nasser Hospital, very often the Israeli occupation administration says that they were targeting the tunnels beneath the hospitals, or they were targeting senior Hamas figures who were hiding at the hospital, or using patients as human shields or whatever. You've been to Gaza twice recently for fairly lengthy periods. Have you ever seen any indication of this?
Absolutely not. I mean, and I say this time and time again in my interviews, and not just me, just to note, every single one of my colleagues has said this, and not only in the media, but, we didn't know each other before this. So these were all individual accounts at different times, different hospitals, different phases of the war. And none of us witnessed militants, combatants, weapons. You would have seen maybe militants brought in because they were injured, in normal war zones, that's what happens. You treat everybody. Never,
Right.
we just never saw them. So, whether they were underground, miles beneath the hospital, obviously I wasn't there. But did we see them in the hospital? No, we lived there day in and day out. We never left. We had access to all areas of the hospital. We were there at all hours, and we actually spoke to the locals, and we became very close to the locals.
Right.
And even in speaking with them, it just never happened. I'm sure they were around the hospital or other places, but they were not in the hospital. To use that as an excuse is a fake justification to destroy the healthcare system. And that needs to be acknowledged, that is absolute absurdity. And it's a war crime. You cannot target civilians. You cannot target children and patients and the most vulnerable time and time again. And it happens all the time.
Alam Media, your spiritual companion this Ramadan.
It's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying, or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
This Ramadan, the PSA will again bring Palestinian voices to you. Join us from Monday to Friday at 4:30 p.m. on Salam Media as we bring you authentic grassroots insight on the day-to-day lived experiences of Palestinians and their struggle for justice and equality. Also join our mass iftar at Emerentia Primary School on Saturday, 15 March from 5:30 p.m. Importantly, support our humanitarian aid drive to support healthcare and housing in Gaza. Contributions can be deposited into Palestine Solidarity Alliance, ABSA Bank, account 4070101666. Kindly reference regarding Zakah or Lillah. For further information, call 082-513-3750. Join our socials for updates on upcoming events, programs, guests, and podcasts. Contact 082-513-3750.
Abu Huraira narrated that he heard the Prophet Muhammad, may the peace and blessings of Allah be upon him, say, "In black seed there is a healing for every disease except death." This Ramadan, experience the health benefits of this ancient blessed seed by using the Tib Black Seed range. Black seed assists the body to boost immunity, regulate blood sugar levels, reduce inflammation, and act as a potent antioxidant. Experience a holistic approach to health by introducing the Tib Black Seed range into your Ramadan routine. Available in capsules, pure cold-pressed oil, and a vapor rub. Trust Tib Health Sciences for quality black seed products. For more information, visit blackseed.co.za. Available at leading pharmacies.
Freedom Stationery supply Marlin and Marlin Kids pens to me and my school friends. They supply just about everything we need to help us get a better education, from books to files to rulers. In fact, any any accessory we need. Freedom Stationery. Education for the nation. What does accessory mean?
This Ramadan, make a conscious choice, sip for change, and support Palestine Drinks Africa. With every can, you help end the genocide and stand in solidarity with Palestine. Choose between our original or sugar-free options, available in a case of 24. Every sip is a step towards justice. Every purchase, a powerful message of unity and support for the Palestinian cause. Contact 082-888-1440 or 082-7739-556 today and be part of the change. Palestine Drinks Africa. Sip for change. Liberty for everyone.
You are listening to Salam Media live from our headquarters in South Africa. This is Salam Media, keeping you company this.
Did you actually experience the targeting of a hospital while you were there?
So right before I got to Al-Aqsa, about a week or so before, the hospital itself was bombed. And there were patients still hooked up to IVs, that were burning in a fire as a result of that. And we all remember those atrocious, those images that came out of it. When I was at Nasser in August, the proximity of the bombing. So one day when it was a mass casualty incident, we were already dealing with all these patients, and a car was bombed right outside of the gate of the hospital. It was so loud and so close. Our ears were ringing, we felt the shockwave of it. The ground was shaking. And so very close, we would hear all of the munition very close to us. And it happens all the time when you're there. And there was this false sense of security that we all have that, we won't be harmed. But we all know in reality, nobody is safe. And it doesn't matter who you are, where you're from.
Right. That must be appalling to have to live with day to day as an emergency physician, but also then even more appalling for the people who are living there permanently and who very bravely have now gone back to try to rebuild their lives there.
Yeah, I mean, that's the thing is we were scared. We don't live there. We get to leave at the end of our mission. But, these poor individuals have to continue and endure all of this. And they'd been already doing it for 17 months. So, it's just a level of cruelty that just doesn't need to happen, and it continues.
Yeah, and especially, as you said, the deliberate targeting of healthcare facilities where patients are vulnerable, where they're children and women. On the subject of children, statistics have shown, but I think I read somewhere recently that Gaza now has the highest number of child amputees in any conflict throughout history. And
Yeah.
I can't imagine what that must be like to see little children brought in without their limbs, some of them with multiple, either both a hand and a leg, or two arms missing, two legs missing. That must just be horrific. As I'm not a parent myself, but I have many beloved nieces and nephews and godchildren, and I can't imagine that horror.
Yeah, I think the number is upwards of 3,500. I was giving a presentation yesterday and I had mentioned that. But yeah, I mean, and it's not, like you said, not single amputations. We're talking multi-limb. And yes, I mean, it's so common that, in the US or in a Western country, even in other countries, like you see them once or twice, maybe, in a couple of years, if it was a terrible place, for maybe once or twice in your lifetime, in your entire career. Over
Right.
there, it's normal. It's like, quote, normal to see that. It's so common to see kids with amputations. I couldn't believe my eyes when I first saw it. And now you're talking about kids who can't receive a prosthesis. There's no way for them to get that. And with a prosthesis, you have to have intense rehab. And not to even mention another layer, which is the roads are destroyed, is completely uneven. So if they're walking on uneven ground. They have a higher risk of getting re-injured. And then the infection rate. One of the little girls I talk about a lot, Mira. She's a 4-year-old little girl, but her mom has an amputation now as a result of an airstrike, and she has to be in and out of the hospital because she's getting infections because of the poor sanitation. So it's so many levels of suffering that it's just hard to put into words.
Yeah, it sounds absolutely horrific. At a more personal level, and before we round up, how do you, as somebody working in that kind of, I can't even call it a war zone, it's a genocide zone, how do you deal with the trauma you take on?
Yeah, I mean, I don't, people ask me that question a lot, and it's not something you ever get over. It's never something that I will forget or move on from, or, hopefully I process it someday, but, it's nothing. Trauma that I have is nothing compared to the trauma that the people of Gaza have. And so that's where I draw my strength from, is if, they have to endure this, then in solidarity, I will also endure this. And that's what keeps me moving.
And their resilience, their strength, their smooth, has been spoken about so much. It's been so astronomical. It's off the charts. But also, I can't help feeling that when people talk about Gaza now and the people of Gaza, that resilience, that strength that they get from somewhere, I think it's God-given, that it's in itself become normalized as part of this genocide. And we need to avoid doing that, don't we?
Absolutely.
To sort of say that it's normal to live like this.
Yeah, that's a very good point, because yes, they are resilient, but that doesn't mean that you continue to impose these cruelties on them. There's only so much a person can take, just natural phenomena. Like, you cannot continue to indefinitely endure these sufferings. I mean, it's not fair, first of all, and it's not necessary. It's absolutely uncalled for and unjustified. And it needs to stop. That's plain and simple. There's nothing else to say about it. It has to end immediately.
Absolutely. How do we get it to end? What do you see as the future?
I mean, there needs to be a sustained ceasefire. I can't, in my mind, imagine a worse situation, a more cruel situation, where they would go back to the same bombardment, the same killings as before. I mean, that doesn't mean that the Israeli military has stopped since the ceasefire. They continue to bomb and kill, and there's still casualties. just not with the same frequency and magnitude. But additionally, just because you have stopped with the bombing and the shellings, there's a lot of repair that still needs to be done. We cannot look away. The hard work actually starts in recovering Gaza and for the people of Gaza. And the answer is not to kick everybody out and fix it and then say you can't come back in. I mean, that's absurd. I don't even want to put it into words to validate it, but that's not what is needed for Gaza. And the security and the safety of the people in Gaza will dictate the safety and the security for the Western world, and that is a fact. If the people of Gaza are not safe, if they are not sound, if they don't have a lasting peace, then neither will the U.S. or any other Western government. And the day that we wake up and we see that, will be the day that we have a peaceful resolution.
Absolutely. Thank you so much. That's a wonderful note to end on, and a hopeful one, that Gaza will not be safe. The world will not be safe until Gaza has peace and safety and security. Dr. Mimi Syed, thank you so much for making the time to talk to us. It's been a pleasure speaking with you and having you share your experiences with our audience. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Aisha.